Hi, my name is Melanie Williams-Mahan. I'm the Executive Director of Partners in Equestrian Therapy. We're a therapeutic riding program for kids and adults with disabilities. Therapeutic riding is a way of using horses to people with disabilities to further their therapy. Meaning it's a lot easier for some of our riders to get on a horse and do certain things because they have this connection with the horse, and it's, you're thinking about a lot of things when you're on a horse. Number one is clearly staying on the horse, and number two is trying to get that horse to do what you want it to do. So it helps them with communication, it helps with balance. It's a really good exercise for your trunk because even though you don't think you're doing a lot of work, your body is constantly adjusting to the movement of the horse. And one of the things that the movement of a horse does is it imitates our walking. So when a person that does not have the ability to walk is on a horse, they're getting messages that's sitting on the horse to the brain that's telling the brain that everything's okay and that this body is walking. It's just so amazing is with kids with autism, we ask them to communicate with that horse. And it's amazing when you see a child that doesn't communicate in everyday life, but he'll tell that horse to walk on because he knows that's the only way to get the horse moving. It's a big accomplishment for them because some of these kids struggle socially. So when they come in and work with the horses, we make it as easy as we can for them, and the horses really get it. A therapy horse is a really, really special animal, and I think it's amazing. I've been around horses my whole life, but I'm happy to do their job. They love doing their job, and I think one of the things that it really, really helps with is children with autism that don't want to speak. And also children that are in a wheelchair that don't have the ability to walk on their own. That horse represents a lot of freedom. And they can also go back to school and tell their friends that they're horseback riders. And that's a big, big accomplishment for somebody that's been told most of their life they can't do things like everybody else. And we teach a combination of riding, just basic riding skills, and we let people move up as they want to. We have several riders that are cantering, and that's a really, it's not an easy thing to learn. It's very natural for the horse, but it's not natural for us. But once they get to a certain point and they can control their horse, which is fantastic too, that you're controlling a 1,000-pound animal. Horses, I think, naturally are a great therapist, meaning when you go out and work with a horse, that horse is kind of a mirror for what you are feeling and what you want in your life. And it's really easy to talk to a horse because they're very non-judgmental and they want to please us. And I think that's one of the things that makes it so accessible, especially for the little kids that come in, and even adults that have grown up around horses and have never been able to ride them. It works out very well for them because this is something that most people don't get to do. The horses are out on a beautiful property, Rancho Del Rio. The woman that owns it, Cindy Nacy, is just a dream to work with. She is in a wheelchair herself, and I think one of the things that she appreciates is what we do for people with disabilities, and we've been very, very lucky to be up there. Beautiful horse property. If you want to ride with us, we ask for a doctor's sign-off that you're physically able to, to do the horseback riding. There's not a lot of things that prevent it, and we have adaptive equipment to be able to get somebody that's in a wheelchair onto the horse. We have a really huge ramp, and we have a mounting block, but it's a very controlled environment, and that's why we use volunteers to be lead walkers, which is responsible for leading that horse around. You can tell a lot from just looking at the horse's head. And so the lead walker is responsible for that horse's head, and if the ears go back or if the eyes get big or if they snort or whatever, then the lead walker can let us know that something is bothering that horse. And we also have side walkers that it's also a volunteer position, and they help the rider before they have balance. We do exercises when we first get into the arena, and the side walker can put a hand on somebody because they won't have their feet in the stirrups, and they'll be stretching and doing all kinds of stuff. So we want to make them comfortable while we're doing that, and that helps the horse too get warmed up for the lesson. And then we start the lesson, and it involves anything from doing a pattern around the arena to learning to canter is a big one too for some of our riders. We had one little girl that couldn't, in the classroom she was really struggling to read. And one of the things that we did for her was we got a little chalkboard and a little dry erase board, and she learned her letters on horseback. And it was a lot easier for her to focus on that one thing and still be on the horse and still have a great time. And she knows her numbers very well now, she knows her letters, and her mother was amazed. One of the things we do teach too when they do the hour ride is to recognize what's going on with that horse, to learn how to take care of a horse. And we teach them the basics of horsemanship, and they fall in love with their horses and they want to learn how to take care of them. And we can teach them that. We pride ourselves on doing a fantastic job with our riders. We want to make people happy, we want to make them successful, and that's one of the things that we are very, very good at. We have volunteers that have significant horse experience, and then we have volunteers that have no horse experience at all. And we get them in the program and we let them do as much as they want to do. Some volunteers that come out and volunteer because they like the way it makes them feel. They feel like they're giving back to the community. We work with 4-H groups, we work with Cal Poly, Questa, and we couldn't do it without our volunteers. Our instructors are certified by PATH, which is the Professional Association of Therapeutic Horsemanship, a certification process where they come out and student teach with a PATH certified instructor for 25 hours. Once they're done with that, there's testing to go through with PATH, and they do online testing primarily, but there's a horse care test, there's a test on riding, how well the riding skills are for the instructor. And then at the end of their, we call it a mentorship, they go to a PATH certified premier facility and they do a little weekend workshop. And there's a panel of judges that will make sure that they're doing everything they're supposed to do. It's very easy to fail this test, and there's a good reason for that, because since we're so safety oriented, you have to have your mind on everything. You have to make sure that their feet are in the stirrups correctly, meaning the stirrup will break away before your foot will get caught in it. And one of the things they also teach is an emergency dismount, where if the horse does get really scared by something and takes off, you can grab that rider off of that horse and everything's fine. And the instructor is trained in all of that. And they're trained to deal with different disabilities. They're trained to make sure that the safety of the lesson is paramount, and they learn so much in that 25 hours and so much from PATH. And we depend on PATH to give us the parameters on how to keep everybody safe, because that's one of the things that makes us very successful, is keeping everybody safe that's on the horse. And they are large animals, but we've learned to work with them very well, and thanks to PATH, we get the certified instructors, and they can teach us what they know too, and it's just really a win-win situation for us. We really like being involved with them.
I'm Ellen Garavati, and I have been working for a therapeutic riding program for the last 5 years. My goal in a lesson is horseback riding. You're in a very powerful position, which sometimes that's a great thing that needs to be strengthened, and sometimes there's people where that's maybe too strong, and it really pushes people away, and as well will push horses away. So learning how to hone your own actions and reactions so that you have a successful ride or grooming session or groundwork session, so that you ultimately accomplish a mutual goal. A horse wants to feel safe and comfortable. A human has to provide that if they're going to be the leader, but also usually humans have higher goals. They hope to accomplish something aerobic or some athletic feat, but it really is teamwork. And those are other skills that we develop while learning how to communicate successfully with our horses. That really is the hope, and something that I really try to aim for personally as an instructor. I feel like every day I hope to connect one thing with a bigger outside goal. And if we connected one thing, and if it makes just a little bit more sense than it did 25 minutes before, we did it. And that's a good day.
Okay, hi, my name is T. Tina. I am an instructor for 19 years. And what therapeutic riding means to me is helping the students, the riders, come in close contact with the horse to experience sensations that they can't experience on their own. Thumbs up. Okay. Let go. There we go. Okay, walk on. Walk on, Chief. Okay. A student that can't walk by themselves can experience the motion of the horse walking. A student that normally wouldn't be able to talk gets so excited that they can express their joy through sounds. All different kinds of disabilities rely on the horse through trust. A student that wouldn't be able to see can trust the horse to guide him. Walking, just a bond forms. It's a beautiful thing to watch and to be a part of. I just feel very fortunate to be a part of this experience. The rider gets to meet their horse and realize that it's not a big, scary animal. It's a gentle soul that is willing to come down to their level and take them on their back, carry them emotionally, physically, form a trust. That's very important because physically demanding on both the student and the horse. And we have very special horses, and they have to know that they're going to have different size riders, different ages, different temperaments of the human that can accept all wide ranges of personalities. So we just match up the horse with the rider, and actually sometimes even let the rider pick the personality of the horse that they feel the most comfortable with. Say, we'll use Ben and Manny as an example, that Ben is going to stand still while Manny gets on, and if the rider is nervous or scared, we can take all the time necessary until he realizes that nothing bad is going to happen to him. And then once they get on and a lot of the fear dissipates, once the horse starts moving, it usually transports the rider to a whole different level. It gets them out of their mind where they're focused on, could be focused on fear of the unknown, especially if they've never ridden before. Time frame for a rider to get familiarized with the horses, it's all unique. Some are natural born riders. They get on and it could be their first time and they join up is a great word to use, and they're naturals. And other students, it could take years of just becoming comfortable with their own bodies and the horse's body. So there is no normal. You know, we start out with somebody leading the horse and then sidewalkers for balancing. And then eventually the rider gets independent enough to steer the horse by themselves and start moving on to a faster pace, which is always the goal, is to be independent for every rider. And the joy that the student experiences when they realize they can do this on their own, and they're in control of this big animal. It relates back to everyday life, that challenges are just one more thing to overcome.
One of the things we do teach too when they do the hour ride is to recognize what's going on with that horse, to learn how to take care of a horse. And we teach them the basics of horsemanship, and they fall in love with their horses and they want to learn how to take care of them. And we can teach them that. We pride ourselves on doing a fantastic job with our riders. We want to make people happy, we want to make them successful, and that's one of the things that we are very, very good at.
My name is Katie Ellis. I am a trainer out here at Rancho Del Rio. I help a lot with therapy riding. You know, it really takes a special horse to do what they do. They have to not only be well behaved, but they have to really love people. There's a variety of people that handle them. They have to be really calm and willing to, work with anyone. All the horses that come in for the therapy program, they're pretty well trained already. There's little things that you have to work on, like say George is a little bit bad getting on and off. Not bad, but he just kind of moves around a little bit. So he'll need some work with the mounting block, but that's easy. Usually if you have a very well-behaved, gentle, sweet horse, those kind of things are very easy to work with. They do a lot of preparation before they put a rider on, getting them used to kind of things around their ears. They throw bean bags just to see how they react. Someone from the program comes out every day and checks on them and gives them their supplements. And I get them out sometimes and I exercise them for them. And I'll usually just do light arena work. They don't need any strenuous exercise. They just kind of need to be moving around. It is very satisfying. They take very good care of their horses, and everyone who comes out here is very happy. All the volunteers and the riders. Every single rider has a smile on their face, and they love coming here. It's just like an exciting place for them.
This is Ben. This is our therapy horse. We got him from Montana 4 years ago. And Ben is almost 8 years old, and he's doing a great job for us here at PET. A rider has to be confident enough to be able to stop Ben. That's one of Ben's biggest faults, is he likes to do what he wants to do, but that's what the riders are learning, is how to control a horse. So it works out well for the riders that are learning how to steer, and it also works out well for the riders that are learning how to stop, because you really have to let Ben know that you want him to stop in order for him to stop. He's a really big horse. Norwegian fjords are mini draft horses. So they have the size of a pony, but not the brain of a pony. And they're real mellow. They really like their job, and they're real easy to work with. Very smart horses. And they work well with other horses, too. We can put a lot more weight on Ben than we could a quarter horse his size. So he works out well for us that way, too. He can carry a whole lot of weight for a horse that's as short as he is. He's 14'2", I believe. We use primarily quarter horses and Norwegian fjords because of that reason, because they tend to work well with therapeutic riding, and they're real smart and real mellow, and just they really like people. And that's what we look for in a therapeutic riding horse, is a horse that enjoys being around people so they can help them learn how to ride. And that's why we're here, so that people can learn how to ride Mr. Ben, and he does a great job with it. We actually got Ben originally from a grant from a program that wanted us to buy a horse that veterans could ride as well as young kids. And that's one of the things that Ben does really well. So we have riders from age 2 to 62 on Ben. So he's got quite the array of riders on him, and he does really well with them. And so he can kind of handle anything. He doesn't like to go real fast, so we tend to put beginner riders on him just so they won't get frustrated trying to get him to trot or canter. He's fine with walking. The trot and canter is a little bit much for him. This is Chief. Chief has been with us the longest. He is 18 years old. His full name is Chief Four Socks, because if you look, he's got 4 white socks. He's a paint horse. Chief has been with us for, I want to say like 9 years now. He's really, really good with therapeutic riding because he's very, very slow. He really understands when a rider is losing their balance, or if they're struggling up there, he'll just stop and let them reset everything. And his personality is just fantastic. He's kind of a clown. He likes to entertain us. But one of the things we figured out is that our therapeutic riding horses aren't working as hard physically as they are mentally, because they have to adjust for the rider on them. They have to figure out if they're listening to a sidewalker, a lead walker, the instructor, or the person that's on the horse. So there's a lot of stuff going on in therapeutic riding, but he seems to really understand it all. He's one of our best horses. He's one of the best horses I've ever worked with as far as personality and just being really, really great with people. But he does love people. He doesn't seem like it right now, but he does. I know he does. And he's my absolute favorite horse. So.
We're always looking for volunteers. You don't have to have horse experience to work with us. We can teach you how to work with our boys.
Hi, my name is Charity, and this is my daughter Brayden. and we have been volunteering with the Therapy Ranch for several months. And we are sidewalk, we supplement, we clean some of the corrals, and it is absolutely wonderful. We just can't believe that we get to be here and do this.
Actually, about 8 weeks ago, I was not able to walk. I have been diagnosed with complex regional pain syndrome and conversion, which sometimes I will have seizures and not be able to walk, and it's very stress-based. And this therapy ranch has definitely helped my stress levels go down. I've been able to walk ever since we started coming here, and it's just absolutely amazing. And this ranch has helped me get stronger and more comfortable and be confident enough to ride.
I don't know where the term healthy as a horse came from, but I don't really believe that that's true. One of the things that we struggle with horses, using horses as therapy tools, is they are very expensive to maintain.
You know, you have hoof care, you have what they can eat, you have making sure that they stay in good condition. And we really depend on volunteers to come out and help us take care of those horses. And we depend on volunteers. We get saddle donations, we get tack donations, we get all kinds of people coming out and just, you know, they will give us money just to continue to do what we do. We are a nonprofit. We are run by a board. We have 7 board members now, and the board basically votes on how we are running the program. And if there's any big decisions that need to be made, that's where we go. We have board meetings about once a month, and it works out really well because we have a lot of different people that are on our board from different walks of life. It's a great feel to come out to Rancho Del Rio and hang out for the day, even if you're just doing it, you know, hanging out with the horses. And they really do mirror what you're feeling, and they understand what you're feeling, and they love to make you happier. It's just one of the great things about a horse, and that's why I love working with them, because they're so positive and they can just turn things around. If I'm in a bad mood, I go see the horses, and it works every time.